We have to defend the Affordable Care Act as it is. We cannot let the Republicans cut it. We can't let them destroy the health exchanges. We cannot let them take an axe to Medicaid. And I want to say on the part, by the way, on Medicaid, yeah, the Medicaid expansion was part of the Affordable Care Act. This business of going after Medicaid overall, they're going a lot deeper and in a lot different direction than just trying to deal with the Affordable Care Act. They're trying to change fundamentally what we've said as a nation. We're willing to put in some money to provide protection for all of us, because we never know whose grandparent is going to need nursing home care, who's going to get hit by a bus and have a disability and need some extra help, who's going to have a baby in the family that's going to need extra care. And we all pitch in together so that there's some basic support. So I think the first thing we have to do is we have to defend. We have got to fight them back on this idea that they can just break the whole system. That's number one, and that's why we're in this. Number two, I think there are a lot of places where we can just make this a whole lot better in a short period of time. So for example, we need to cut the cost of prescription drugs, and there are multiple ways to do it. I've got a bill, Bernie Sanders has got a bill that I'm part of that says, let's be able to import our drugs from Canada. There are a lot of drugs that we're paying as they pay in Canada. And here's the deal. It would both bring down costs, out-of-pocket costs for everybody in this room who's got a prescription drug, but it also would help bring down the cost of the insurance and bring down the cost to the government, which means there'd be more money to spend in other areas where they're needed. So that's part two. There are changes we have known from the beginning that we needed to make in the Affordable Care Act. We couldn't get a single Republican to come to the table to negotiate with us over that. And the result was we just had to leave it locked, because the fear was open the door and they're going to come in and try to repeal it outright. But part three, where we have got to be headed, is we need to talk about how to do the expansion of Medicare. We're familiar with Medicare, we know how Medicare works. Medicare has worked for people over 65 now for 2 generations, and it has made a huge difference in the lives of Americans all across this country. It is a good model for us to work from, and we've got a lot of options on how we can do it, how we can do the buy-in, how we can change the age ranges. But make the program out there that's going to work for people across this country. That's the direction we got to move. I think that's